Here are some questions and answers of objective type model from vital signs of the subject foundations of nursing. First question is the part of the body which regulates body temperature is options A cerebrum, B cerebellum, C hypothalamus and D thymus. Correct answer is hypothalamus. Hypothalamus is the part of the brain that regulates body temperature. Second question is the condition in which the patient can breathe only in an upright position is called A. Dyspnea, B. Orthopnea, C. Bradypnea and D. Hyperventilation. Correct option is orthopnea. Orthopnea is a disease condition where the patient can breathe only in sitting position or in an upright position. Next question. The primary respiration regulation center is situated in options hypothalamus, medulla, heart, lungs. Correct answer is medulla. Respiratory regulator center is situated in medullary part of brain. An elevated body temperature above 40 degrees centigrade is called A. Hyperthermia, B. Hypothermia, C. Heat cramps, D. Thermoregulation. Correct answer is hyperthermia. Hyperthermia is a condition where the body temperature rises above 40 degrees centigrade. Next question. The difference between apical and radial pulse rate is called options A. Pulse pressure, B. Pulse deficit, C. Volume of pulse and D. Rhythm of pulse. Correct answer is pulse deficit. The difference between apical and radial pulse is called pulse deficit. Next question. A pulse with irregular rhythm is called options A. Bradycardia, B. Tachycardia, C. Arrhythmia and D. Pulse pressure. Correct answer is arrhythmia. An irregular rhythm in pulse rate is called arrhythmia. The normal respiratory rate for an adult is options A. 16 to 20 breaths per minute, B. 20 to 24 breaths per minute, C. 24 to 28 breaths per minute and D. 28 to 32 breaths per minute. Correct answer is 16 to 20 breaths per minute. Next question. An abnormal respiration with alternating periods of apnea and hyperventilation is called options A. Kussmaul's breathing, B. Chain stroke respiration or chain stroke breathing, C. Orthopnea and D. Apnea. Right option is chain stroke respiration or chain stroke breathing. Next question. Difficulty in breathing or labored breathing is called A. Dyspnea, B. Orthopnea, C. Hyperpnea and D. Apnea. Right answer is dyspnea. Difficulty in breathing or labored breathing is called dyspnea. Next question. Kussmaul's respiration is characterized by A. Labored breathing, B. Breathing easy in sitting position and C. Abnormally deep regular respiration, D. Hypoventilation. Right answer is abnormally deep regular respiration. Abnormally deep regular respiration is called Kussmaul's respiration. The instrument used to measure oxygen saturation is called options A. Thermometer, B. Sphygmomanometer, C. Pulse oximeter and D. Stethoscope. Right answer is pulse oximeter. Next question. The pressure of the blood during contraction of the left ventricle is called options A. Systolic pressure, B. Diastolic pressure, C. Pulse pressure, and D. Elasticity. Right answer is systolic pressure. Systolic pressure is the pressure exerted by the blood on its blood vessels during systole of the heart or during contraction of the ventricle. Next question. The pressure exerted by the blood during resting phase of ventricle is called A. Systolic pressure, B. Diastolic pressure, C. Pulse pressure, and D. Cardiac output. Right answer is diastolic pressure. Next question. The difference between systolic and diastolic pressure is called options A. Cardiac output, B. Elasticity, and C. Pulse pressure, D. Peripheral resistance. Right answer is pulse pressure. Next question. The series of sounds heard when assessing blood pressure is called A. Heart sounds, B. Murmurs, and C. Korotkov sounds and the ventricle. Right answer is Korotkov sounds. Next question. The instrument used to measure blood pressure is options A. Thermometer, B. Pulse oximeter, C. Sphygmomanometer, and D. BP cuff. Right answer is sphygmomanometer. A blood pressure that is above normal is called hypertension, B. Hypotension, C. Bradypnea, D. Tachycardia. Right answer is hypertension. Decreased blood pressure than normal is called A. Hypertension, B. Hypotension, C. Tachycardia, and D. Bradycardia. Right answer is hypotension. A feeling of weakness or fainting when a person comes to a standing position suddenly from a lying down or sitting position is called options A. Hypertension, B. Hypotension, C. Orthostatic hypotension, and D. Tachypnea. Right answer is orthostatic hypotension. Fifth vital sign is A. Temperature, B. Pulse, C. Pain, D. Respiration. Right answer is pain. The difference between the amount of heat produced by the body and the amount of heat lost is called options A. Body temperature, B. Thermoregulation, C. Pyrexia, and D. Hyperpyrexia. Right answer is body temperature. Body temperature is the difference between the amount of heat produced and the amount of heat lost, or it is the heat maintained by the body. It is called the body temperature. Transfer of heat from a molecule of high temperature to a molecule of low temperature that is in contact is called A. Conduction, B. Convection, C. Radiation, D. Evaporation. Right answer is conduction. Conduction is the process of transfer of heat from more heat to an area of less heat where the molecules are in contact. The process of transfer of heat by air current is known as A. Conduction, B. Convection, C. Radiation, and D. Evaporation. Right answer is convection. The process of transfer of heat from one surface to another without needing a medium is called A. Conduction, B. Convection, C. Radiation, and D. Evaporation. Right answer is radiation. A medical emergency shows body overheating as a result of prolonged exposure to the sun or high environmental temperature is called A. Conduction, B. Convection, C. Heat stroke, and D. Evaporation. Right answer is heat stroke. Heat stroke is a medical emergency which shows body overheating due to prolonged exposure to the sun or high environmental temperature. A medical emergency shows body overheating as a result of prolonged exposure to the sun or high environmental temperature is called A. Conduction, B. Convection, C. Heat stroke, and D. Evaporation. Right answer is heat stroke. Heat stroke is a medical emergency which shows body overheating due to prolonged exposure to the sun or high environmental temperature.